Good afternoon, everyone. Glad to be with you this afternoon, this Friday afternoon. Looking out my window here, it's cold. It's given a little snain. I think that's what the weather people call it, a mixture of snow and rain. But nothing seems to be sticking, which is good. Last night, our street department pre-treated the streets. Now, having said that, I know that when it rains, that kind of washes some of that off a little, but they had to do that pre-treating because, of course, you never know. You're right on this cusp here. The temperature could go either way. So, drive careful out there. The forecast isn't too bad. It's not for hardly any accumulation. So, hopefully the forecast is right. Anyway, it's Friday afternoon. I got a couple of things to chat with you about this afternoon. Of course, we're going to talk about the COVID numbers. We're going to talk about the vaccine and vaccinations. And then we'll take your questions. So, COVID numbers are continuing to be high, but they continue to be a little bit better each day. Not noticeable, not distinctly better, but a little bit better. Yesterday, we reported 77 cases, new cases in the city of St. Louis. So we are running on average right at 120 cases per day, new cases. And that's a 7-day rolling average. You'll see when you go back 7 days here, we had some days, we had a day that was 160 and a day that was 144, but since then, our numbers have been trending down pretty well. So hopefully that will hold. You know, one of the things that I was going to point out today is that, you know, we are continuing to do a lot of testing in the city of St. Louis. Our positivity rate, 7-day positivity rate, is down to about 12%. We're glad about that. It's still too high, but it was up in the 20% range. So it's down to about 12%. You know, I think this is kind of interesting. The city of St. Louis, since the pandemic started, has done 225,000 COVID tests. It's a lot of tests. And of course, many people have had them test more than once, but still 225,000 tests done in the city of St. Louis since it began. And so we've got to continue to test even though the vaccine is on the way. And you've got to figure out who has it, to the extent you can, how they got it. So I think that's some interesting COVID information. We're glad that our positivity rate is down. Our testing is still going strong, and so it's still, everything's still too high, but it's all relative. Now, talk about the number of people that are in the hospital. For those of you who watch regularly, you know hospital data runs 2 days behind. So this data is probably Tuesday's data, maybe Wednesday's data. Total people in the hospital, either with COVID positive or suspected COVID positive, dropped below 800. It was 794. That's good because it's been up as high as, you know, if you go back here a month or so, it's been up over 1,000. So now we're under 800, 794 people in the hospital in the region, in our 4 major hospital systems. Of those people in the hospital, of the 794 people in the hospital, there are still a lot of them in ICU, 153 people in ICU. And of the people in the ICU, 86 of them are on ventilators. Those are still high numbers. Those are people that are very ill. So hopefully they will make a good recovery. Number of patients admitted to the hospital 2 days ago was 112. We had been down in the 80s. Of course, some of those days were over last weekend. Not as many people are admitted on the weekends as there are during the week. Not as many people are tested on the weekends as they are during the week. And 190 129 people were discharged from the hospital. So those are our COVID numbers, new cases, positivity rate, number of people in the hospital. We still, in the city of St. Louis, we are running on any given day. This is a 7-day rolling average. We're running about 40 new cases per 100,000 people, and that's how we get to 120,000 average cases. And that still is the lowest in the region by a good margin. I attribute that to all of you who are wearing your mask, social distancing, washing your hands, and to our business owners who are doing their best to do a good job to comply with all these mitigation procedures, which makes a difference. So that's COVID numbers. Now, the thing everybody wants to know about, the vaccine. When can I get my vaccination? So the state of Missouri to date has received a little over 500,000 doses of the vaccine. Only about, I don't have the number in front of me, but about a third of those cases have actually made it into arms, which that's the only thing that counts. It's great to have the vaccine, got to get it in arms. And so everybody is beginning to ramp up. We need to be assured of a steady supply. City of St. Louis has not received our first shipment yet of the vaccine. We ordered 5,000 doses, which would cover our first responders primarily, police, fire, corrections, etc., and a few more. We are still hopeful. We really thought we might get some this week, but there are many other counties in Missouri who also have not received any vaccine. So we are hopeful that that will be in the very near future. And when that occurs, and I'm sure you may have seen that the governor yesterday said that we could move to phase 1B. Now, we're still in phase 1A. The state is still in phase 1A. And phase 1A is long-term care facilities, their residents and their staff. So nursing homes, residential care facilities. It's public-facing healthcare workers. People who work in the hospital. Maybe they're doctors and nurses. Maybe they're working admitting. Maybe they work in dietary, but they are in contact with patients. And I know from our call on Tuesday with the Pandemic Task Force that virtually all of the public-facing hospital employees have been invited to get the vaccine. Many of them, 60+% of them, have received the have said, yes, I want it. You invited me. I want the vaccine, and they have received it. In fact, they are starting on round 2. You know, on the Pfizer vaccine, 2 shots, 3 weeks apart. On the Moderna vaccine, which the hospitals don't have that, they're using Pfizer right now. On the Moderna, it's 2 shots, I think 4 weeks apart. Nobody in the St. Louis region yet has Moderna that I'm aware of. So once we get our vaccine, of course, we're going to vaccinate our firefighters, our police officers, our corrections staff, our morgue, of course, EMS, EMT, paramedics. They are all in phase 1A, and then first responders in phase 1B. Next, the next tier. It's on our website, by the way, if you're really interested in sort of digging into the details of this. But the next tier is high-risk individuals, and that is people over 65 plus people under 65 that have a chronic health condition. Now, we know that in the city of St. Louis, there are 41,000 people over 65. That's based on recent census estimates. So if we have 300,000 people, 41,000 of them are over 65. Now, we also know that we have about 60,000 people in the city of St. Louis, 60,000 kids, 0 to 18. So you got 40,000 over 65, you got 60,000 under 18, So you're left with about 200,000 people in round numbers that are between 18 and 64. Of those 200,000 people, we don't have a way of knowing how many of them have chronic health conditions. But let's just, make some guesses here. Maybe 20,000 of them. Would 10% of the people between 18 and 64 have some kind of chronic health condition? Maybe. So those people, the over 65 and the folks under 65 with chronic health conditions, are in the next tier after we get through first responders and emergency workers, etc. So we are working to develop partnerships with various agencies that will be able to help with the vaccination process. We don't actually give vaccines ourselves, but we will be working with our federally qualified health centers. We hope to also be working with CVS, with Walgreens, maybe some of the retail operations. We're in discussions with them about that right now, because that's a big group of people when you think about 40,000 people over 65. And one of the things that I've read, and it makes some sense, people over 65 are taking the vaccination at a higher rate. I think that makes sense, because people over 65, they don't want to get it, and they know that if they do get it, they're likely to have very adverse effects of COVID. So I'm glad to hear, if it turns out to be true, that people over 65 are taking it at a higher rate, because they're going to have the worst outcomes. I shouldn't say they, we are going to have the worst outcomes. So at any rate, that's the vaccine. You heard you heard President-elect Biden last night in his speech commit to rolling this vaccine out as quickly as possible, a goal of vaccinating 100 million people in 100 days. That's a very audacious goal, but we all have to gear up for this, and it's going to take partnerships, because we don't want to see long lines, and we don't want to see any vaccine a logistical challenge. Everybody's rising to the occasion to meet that challenge. So that's COVID numbers, that's vaccinations. A little about the weather. I guess the last thing I'll say is today is actually Dr. Martin Luther King's actual birthday, January the 15th, so happy birthday. As you know, the whole country celebrates it on Monday. So City Hall will be closed on Monday. Most government offices will be. Most offices, I think, in general, are closed on Monday. So happy birthday to Dr. Martin Luther King. And we're happy to celebrate on Monday. So, questions?
Okay, questions. First from Andrew today, who's watching.
Hi, Andrew.
Does the city of St. Louis or the state of Missouri get to decide what tier we are in currently when it comes to vaccines and vaccinations?
Really the state of Missouri, but the CDC gets to decide. We are getting our vaccine. This is a free vaccine as soon as we can get it quickly. We're getting our vaccine, of course, through the CDC, so you got to follow those guidelines.
Chris's question has to do with primary care providers who have said they'll offer vaccines.
Mm-hmm.
If they don't have it yet, do we know when providers who are unaffiliated with the major hospital systems might be able to begin vaccinating people?
We don't know that yet. They would also have to either receive their vaccine from the state or more likely through hospitals. And almost all primary care doctors, medical doctors, are affiliated with some hospital. But the other folks who are also, of course, healthcare workers are dentists and physical therapists, and there's a lot of other people in that group as well.
Suzanne's question has to do with what the governor mentioned about entering Tier 1B.
Mm-hmm.
Without having vaccines in the city, is the city able to move into that tier, or where do they begin whenever they get their vaccine?
Well, what the governor really said is that once you get through Tier 1A, then you can go into I'm saying this wrong. The terminology is a little bit difficult. It's Phase 1A, and phase 1B, tier 1, tier 2, tier 3, just to make it hard to talk about. So we will, of course, get through phase 1A first. Nursing homes, nursing home workers, public-facing healthcare workers. And then the last thing in phase 1A is EMT, EMS, and paramedics. And as soon as we're through that, we will go to phase 1B, tier 1, which is first responders and emergency workers. And after that is tier 2 under phase 1B. So.
Question about the positivity rate. You talked about it going down. Is it going down because of fewer tests happening, or is it going down because you think people are doing a better job of some of the recommendations?
Well, the more tests you do, in general, this is a generalization, your positivity rate will go down. So if you only test the people that, let's say, are sick and going to the hospital, that's what we were doing way, way, way back when, the positivity rate's going to be very, very high because you've already got people with symptoms, they're going to the doctor or the hospital. A higher percentage of them are going to test positive. So our positivity rate is going down. Our testing is about the same as it was back before the holidays. And so I think that's good because our testing is not fluctuating wildly. I happen to have, let me dig it out here. So last week, the week ended last Sunday, we had done 7,700 tests for that week. The week before was 6,200. Don't forget, that was the week of New Year's. Not so many people testing. The week before that was 6,400. That was the week of Christmas. Whoops, I don't have, pardon? Oh, one more page, hang on. And then the week before that, when you're talking about the middle of December, it was 7,800 people, 7,600 people, 8,200 people. That was one week, the week right before Thanksgiving, 7,600 people. So our testing is back up to more of a normal level, which is a little over 1,000 tests a day just in the city of St. Louis. So I think this is a real decrease in the positivity rate because when you go back to other weeks, a couple, 3 weeks ago, when we were testing a similar number of people, our positivity rate was running 15, 16, 17%. So I believe this is a real decrease in the positivity rate. Now, it's got to stay down. And anytime, you know, we're always sort of on the lookout for anything that would just be an anomaly. But I think that in this case, this is a real decrease in the positivity rate. 12% is what it is for the last 7 days, and that's the 7 days ended last Sunday. Because anybody who's gotten tested this week, many people, not enough people have gotten their results yet. So you go back a week. It was 12% last week. If you take the last 2 weeks together, it was 13.3%. So you can see that week, 2 weeks ago, was a little higher. That's probably more numbers than most of you want to know, but that's one of, you know, we're looking at these numbers every day and trying to assess what's really going on.
Other vaccine questions. Kim would like to know, do you know if the city gets Pfizer or Moderna, or if you have a say in what you get?
We don't know. We are waiting for a response could come from either Pfizer or Moderna. And we are prepared to handle either dose. We do have a freezer, and so we don't know. And, you know, we may get Pfizer sometime and Moderna another time. We just don't know that yet.
Cindy's vaccine question. For the folks in the tiers, do you know or anticipate that people, like if you have pre-existing conditions and fall on tiers, do you have to prove what your condition is or how you qualify when it's your turn to be able to get vaccinated?
You know, I think that you may have to certify to it, attest to it, but actual proof, somebody with, let's say, a heart condition, how would you prove it? You would have to have a doctor's note. So I don't believe you're going to have to prove it in in a real firm way, but you probably will have to attest to it.
So some other questions we got have to do with the CARES Act, second CARES Act. Do you have a timeline on when some of the rental, this is from Alan, do you have a timeline on when some of the rental relief will be more available to people in the community?
So rental assistance is still available because I call it CARES Act 2. It's actually House Bill 133. Was that its number? I think that was right. But it extended the previous CARES Act funding. So there's a little bit of funding left there, and we're still paying that out. We filed last Thursday, I believe it was, the first day that we were able to file with the U.S. Treasury. We filed to get the funding for the rental assistance directly coming to the city. This was available to cities with over 200,000 people who filed this paperwork with the U.S. Treasury. We did that on the first day that we were available to, that it was available to file. So we are expecting to get those funds. I believe those funds have to be dispersed to cities within 30 days of the date the bill was signed. And the president signed the bill a couple of days before New Year's, 28th maybe. So by the end of January, we should have that $9 million in rental assistance money available, and would be then beginning through our partners to process those applications for people who need rental assistance because they've lost their job because of COVID, had their hours reduced because of COVID. So it won't be, it's the 15th today, it's a couple more weeks.
Bill has a question about our vaccination notification survey.
Mm-hmm.
Other jurisdictions have launched them. County is one example.
Mm-hmm.
Are you allowed to enter your information or fill out surveys in multiple jurisdictions? Do you have to reside in the jurisdiction in which the survey you are filling out, but you work in another jurisdiction?
I think you are allowed to do that, but understand that, let me just say that we launched our survey about 48 hours ago, a little more. So as of this morning, was it this morning or was it last night? Okay. We had received 13,000, I had the exact number here, 13,243 people had filled out our survey. So definitely sign up if you are a city resident. Understand that what you're signing up for is information. You'll be updated about, okay, your tier is up, it's your turn. So it's a way to stay on top of your tier. And how will we know that? Because one of the things you have to do is fill out your birth date so we know how old you are. We'll have your email address, of course, so we can email. This will be done via email. And we're also asking for your occupation. So if you're a police officer, if you're a school teacher, there'll be a point in time school teachers, and it's not in the too distant future. That is going to be, when is it? It's a little ways off. It's on our website, I believe. When are teachers? Teachers are going to fall into Phase 1B, Tier 3. So teachers, childcare workers, food and agriculture, government, transportation systems, people who work for the water department or MSD, those folks will be after the high-risk individuals.
And then I think we just have two last questions, sort of about events and COVID-19. Ryan's question has to do with a trade show that was delayed from last fall, rescheduled for May. Are we optimistic that that time frame, that big events like trade shows and large gatherings will be permitted again in the region?
Well, they'll be permitted. Will they be permitted in May? Let's think about this. That is February, March, April, middle of May. That's about 4 months away. If we look back 4 months and see what's happened it's very tough to predict, but I am hopeful that that event will be able to occur in at least to some extent. It really just depends on what our numbers look like, which is going to depend on how diligent we are about the mitigation procedures and how diligent we are, how much vaccine we get, how many people take the vaccination. So there are a lot of factors that will go into that decision. Right now, I'm hopeful that we'd be able to do that, and I don't know how big of a trade show it is or what the circumstance is here. But you know that I think it was the car show had to be canceled last week because here we are still running these extremely high numbers. So I'm hopeful that that will be the case, but there's just a lot we don't know yet.
And last new question, and
Sorry,
similar,
my phone is beeping. There we go.
last question, Will, similar, a little bit lighter note. What about Cinco de Mayo? That is from Will.
Will, gosh, hola. I don't know. I think, you know, St. Patrick's Day parade has been canceled, but Cinco de Mayo is about 6 weeks after that, 5th of May, St. Patrick's Day, 17th of March. So I don't know. I think that it's very hard to figure that out. I don't know that we will be able to be in big crowds, say on the public street, you know, shoulder to shoulder with people yet on May the 5th. I wish I knew the answer for sure, because I'd like to give it to you, but we don't know.
And okay, last question, but also similar, from Andrew. How much of a say do you or the city get in determining when fans can come to Enterprise, return to a Blues game, or maybe even a Cardinals game in the spring?
We are working with both of those entities, both the Blues and the Cardinals, to try to work out. You saw that the Blues played night before last, I guess it was, to 300 guests. Well, obviously that's not enough, and that's not what they want to do. But if I think it's likely that over time it will ramp up. When will it be back to where you can have a full Busch Stadium or a full Enterprise Center? That's a ways off.
That is it for questions.
That's it. Thank you all. Have a great weekend. Drive safely out there in this kind of inclement weather. It's almost like it's winter now. We haven't had much winter yet. I can't say that I missed it though. So have a great weekend. Enjoy yourselves. Be safe out there. Wear your mask. Thanks. Bye-bye.